Clinical staff text each other lab results on WhatsApp. They coordinate care in group chats. It is fast, it is convenient, and it is the weakest link for breaches, with fines up to $1.9 million per violation category per year. Here is what HIPAA actually requires for messaging. HIPAA is the U.S. federal law protecting patient health information. For messaging, two rules do most of the work. The privacy rule, which says who should be able to access patient data, and the security rule, which says how it must be protected. A third, the breach notification rule, gives you 60 days to report a breach. Any message containing patient information, even between your own staff, falls under these rules. When you evaluate a messaging platform, the technical safeguards are where decisions get made. Encryption for data in transit and at rest. Role-based access control, so administrative staff cannot open patient records. Multi-factor authentication with single sign-on. Automatic session timeouts and remote wipe for lost devices. Tamper-proof audit trails with HIPAA mandating 6-year retention. And configurable retention with real data residency, knowing the specific region your data lives in. The staff sending patient information over iMessage are not being careless. The problem is structural. Consumer messaging was built for convenience, not for healthcare's legal requirements. SMS is unencrypted in transit and stored by carriers. There is no business associate agreement, no audit trail, no access control. Texting patients is not itself a violation. Doing it over a channel with none of those protections is. Both cloud and self-hosted platforms can be HIPAA compliant. The difference is where control sits. In the cloud, audit access goes through the vendor and responsibility is shared. Self-hosted, you own the servers, the logs, and the configuration. That is the model Ethora is built around. Run the chat and AI stack on your own infrastructure with audit trails, secure attachments, and every message staying inside your environment. The full guide, with a 12-point vendor checklist and an 8-week implementation roadmap, is on the Ethora blog. And if you're building a healthcare product that needs compliant chat, that is exactly what we make at Ethora. Thanks for watching.